Air pollution is a major global environmental risk to our health and food security. It is estimated to cause millions of premature deaths worldwide and destroys enough crops to feed millions of people every year. Major sources of air pollution include insufficient modes of transportation, household fuel and waste burning, coal-fired power plants, and industrial activities. Ambient or outdoor air pollution is estimated to cause 3 million premature deaths worldwide. About 88% of those deaths occur in low and middle income countries. People living in these countries disproportionately experience the burden of outdoor air pollution, with the greatest burden being in Western Pacific and Southeast Asia regions. Household air pollution is an even bigger problem. Around 3 billion people still cook and heat their homes using solid fuels. Such insufficient cooking fuels and technologies produce high levels of household air pollution. About 4.3 million people die per year prematurely from illnesses attributed to household air pollution. Based on figures from the WHO, 92% of the world's population is exposed to particulate matter air pollution concentrations that are above the WHO air quality guideline levels of less than 10 micrograms per meters cubed. With the exception of the Americas, all regions have less than 20% of their population living in places that are compliant with these guidelines. While historically air pollution has led to a smaller portion of individuals dying from diseases like lung cancer, the numbers are consistently rising. To date, 17% of annual premature lung cancer deaths in adults are attributed to household air pollution, and 14% are attributed to ambient air.
Air pollution has become one of the most serious environmental problems in China. The major source of atmospheric pollution in Chinese cities come from coal burning for electricity generation and industrial production, as well as residential heating and cooking. Though the most serious health effects are due to long-term exposure, there are short-term consequences. Long-term consequences due to exposure to air pollution may include difficulty breathing, eye irritation, and coughing. Long-term exposure consequences include asthma, lung cancer, shortness of breath, and death. In large cities where pollution conditions are complicated by both coal smoke and exhaust from sharply increasing vehicle pollution, pollutants such as NO2 and O3 are becoming more significant. Despite the increasing importance of natural gas in urban areas of China, coal, wood, and other biomass fuels remain the primary heating and cooking methods for Chinese population. Day-to-day actions such as cooking food with oil and heating a pot of water with biomass greatly increases the likelihood of developing lung cancer. Households with a higher income can afford to have cleaner cooking methods and proper ventilation, which helps to avoid this buildup of air pollution.
Lung cancer in China, caused by air pollution, is a global health issue because it affects a developing nation, affects all social stratas, and demonstrates the flaws of the political and social institutions in China to address this issue. According to a cross-sectional study in 2000, people living in eastern China, particularly women, had a higher lung cancer risk than those living in western China, and people living in urban areas had a higher risk than those living in rural areas. We can see that lung cancer mortality has increased by 464.84% during the past 30 years, and an estimated 600,000 people die from lung cancer annually. Morbidity and mortality rates in both urban and rural China are higher than the worldwide average, presenting a global health issue as it imposes a deep burden on the worldwide incidence towards patients, healthcare professionals, and society.
While tobacco smoke is currently listed as the main contributor to lung cancer in China, experts predict that air pollution will soon replace its position. Effective interventions can be achieved in a variety of ways, such as enforcing stricter regulations on polluters in China, as seen in the National Environmental Protection Plan. However, we call for a three-pronged approach addressing what many refer to as a triple neglect situation, which states that the high lung cancer incidence and mortality rates in China are due to the neglect of prevention, screening, and supportive care. We recommend that the government of China increase funding to the HTH campaign, organized by the Chinese Alliance Against Lung Cancer. The campaign plans to address prevention and supportive care by implementing a 5-year education plan for thousands of specialists and patients across the country. The campaign also seeks to address screening by widening the inclusion criteria and promoting the use of cost-effective screening techniques, especially in rural areas. The campaign also calls for the opening up of more than 100 subcenters to facilitate the treatment and screening for lung cancer, which will increase access to thousands of individuals. The HTH campaign will require political buy-in from all levels of the Chinese government. One way this can be achieved is by highlighting the current economic burden caused by the treatment of lung cancer. By framing the issue in a manner that highlights the campaign's ability to reduce treatment costs, political buy-in may just prove to be attainable. Another challenge is funding. Efforts should be made to leverage financial support from other stakeholders like the WHO. Another approach is increased taxing of tobacco products in China. Currently, 30% of global tobacco products are consumed in China, and higher taxes could prove to be a major revenue source for intervention. Lastly, buy-in from the medical community should be improved as the absence of prevention and early diagnosis seen in China is partly due to their lack of attention towards the issue. As a result, it is vital that medical professionals improve not only their own awareness, but improve the awareness of their patients who many times are not knowledgeable on the symptoms of lung cancer. According to Hong et al., 80% of lung cancer patients receive treatment too late. Thus, with the support from all parties, our intervention can drastically reduce both this number and the high mortality and incidence rates seen among patients, enabling them to lead longer and better quality lives.